right, welcome back to the program. Going to spend the next segment talking about the International Overdose Awareness Day and how that's being marked on Saturday here in Port Angeles for Clallam County. We welcome the health officer for Clallam and Jefferson Counties, Dr. Allison Berry, back. Allison, it's been a long time.
It has.
And we're not talking about pandemics or anything like that.
I'm so excited about that.
It's a whole different thing. So good to see you again. And Colt Smith is here. He's a treatment center director at the BAART Programs locally. And Colt, good to see you too. Thanks for coming in.
Howdy, hello.
And let's talk first a bit maybe about International Overdose Awareness Day, how it got started, and really what that means here locally. And I'll go to the good doctor to talk about this, because this really is impactful as a community public health sort of issue.
Yes, so International Overdose Awareness Day started in 2001, so it's been going on for over 20 years. And at that point, that was in response to a rise in overdose deaths that we were seeing back then. Unfortunately, since then, overdose death rates have only continued to increase, dramatically so since fentanyl joined our region. And so it's all the more important now to talk about it and break down stigma around it and build some community to try to tackle this.
So that's the event for Saturday and how it's being marked here. And there's a whole bunch of things that go with it. Colt, maybe I'll go over, you can talk about. There's a resource fair that kind of starts things off. Take us a little bit through what Saturday looks like in Port Angeles.
Yeah, on Saturday, the International Overdose Awareness Day here in town is going to be at a couple of locations. The resource fair is going to start at the pier from 11 to noon. There's also going to be a march to the courthouse and a remembrance ceremony and an art wall. So many different events and locations, including food and music, and a way to remember some folks that deserve some remembering.
This has, correct me if I'm wrong, I mean, it seems like this has gotten to be a more of a bigger event locally than even in the past. This has been marked for a number of years here, but this is getting more and more organized, it seems.
I think there's been more and more groups coming together to get it done. Particularly our neighboring tribes have really been taking the lead. So, the Jamestown Clallam tribe, the Lower Elwha Clallam, the American Indian Health Commission, and our partners at North Olympic Healthcare, BAART, Jamestown Healing Clinic, and the Health Department kind of all came together to try to make this a meaningful event. Not just, we've always taken the time to remember the people that we've lost, but also try to take that next step to build that community and get people access to the resources to make sure that overdoses are less likely to happen going forward.
Suffice to say, Colt, this is really twofold. I mean, it's to reach out to people who have been affected directly by, overdose or drug abuse or something like that, or an addiction issue, but also maybe their families, friends as well, to just be aware as to what's going on or how they might help folks that are in trouble.
Yeah, so in remembrance, we're able to spread some of this awareness, because the issue that we're talking about has the chance to be prevented. The more that we can talk about this, talk with our friends about how to intervene and how to respond to overdose or to opioid use disorder, we have the chance to help some people heal.
Allison, yeah.
Opiate use disorder is treatable. We've got good medicine for it. We've got ways to help people get better. And just making sure that people know how to access that and how to reach out to family to encourage them when that time comes. And, of course, we'll also be there providing naloxone and training in how to use it, which is the overdose reversal medication, which can go a long way to keeping our neighbors alive.
I just was talking with Mark Nichols, coroner, gave us some sobering stats again. Clallam County is like third per capita now in the state in this past year for overdose deaths. Not a great place to be.
No.
So your thoughts as the health officer, in fact, I even said that to him. I said, this is a public health issue.
Yeah, we have unfortunately been leading in opiate overdoses and overdoses generally for years in our county. That really started from prescription narcotics back in the day, but has really moved into illicit drugs at this point. And it's not just opiates, it's opiates and methamphetamines. We see a lot of alcohol involved in these overdoses as well, so it's really kind of a mixed bag of what we're seeing. We used to be number one in opiate overdoses in the state, and thankfully we're not that anymore, but moving down to second or third is not as far as we'd like to go. What I always tell folks is we didn't get into this overnight. This problem didn't start overnight, and it's not going to go away overnight. It's going to take all of us working together to get ahead of it. But unfortunately, because we've had so many folks that we've lost, really most families that you know are affected in some way. They know somebody who had an overdose or somebody who has a use disorder that has affected them, and it's really important that we be aware of that when we talk to our neighbors. You might not know it to look at them, but most people you know have been affected by this epidemic in some way or another.
Yeah. How do you help get folks into treatment? That's really an issue, and we'll probably talk to the treatment guy about this as well. But first, from you, Allison, a bit about, because that's really the key, but that's really the highest hurdle, perhaps, for a lot of this.
It's super hard. For the longest time, and still to some extent today, that we've done a lot of work to make it better. In most of this county, it's easier to access drugs than it is to access treatment. I have a lot of patients who come to see me, so I also work at the Jamestown Healing Clinic part-time. I have patients who drive 2.5 hours to see me, and they could get fentanyl down the block. And so as long as that is the scenario where drugs are easier to get than getting sober, we're going to keep seeing this problem. But a lot of getting people into, helping people access recovery when they're ready is getting rid of those barriers. So, the barriers for my patients are often quite simple to the rest of us, but they're insurmountable to them. They don't have a car. They can't get there. They walk through the front door and someone asks them for an ID and they don't have an ID. Things that seem really simple to those of us who aren't in that position of struggle, but is insurmountable for my patients. And a huge barrier, one of the biggest barriers my patients often face, is fear and stigma. They're afraid that they're going to be received badly when they walk through the door, because often they have been in other health systems. And so showing folks that they can be received well, they can be cared about, that we're here just to help them, and to meet whatever needs they have, goes a really long way.
Colt, I guess same question to you, just your observation on getting people into treatment and keeping them in it, too. That's another issue.
When folks are walking into BAART programs or any treatment center that I've worked in, we notice that front door can weigh 10,000 pounds. It's incredibly difficult to build the courage to walk in, right? When a new person is walking in, a new patient is walking in, and they're treated with dignity and respect, and you can see pieces of hope, pieces of light shining from them, that's when you know you have a chance for this treatment to stick. And just like Dr. Berry is saying, that the barriers that we overcome for them to not just walk in, but to continue engagement through the course of treatment seem insurmountable. And there are plenty of times where we're able to overcome some of these barriers and help someone engage long term. What we know is that when our folks engage in treatment for longer courses of treatment, that the outcomes are improving. So finding ways to keep our patients engaged is what helps them find wellness over time.
Take us through a bit about just kind of the ravages of addiction, too. I mean, this is a quick and slippery slope for a lot of folks. I mean, they never intended to get to where they're going to need treatment, right?
Absolutely.
In many places, many cases.
We will often see that the drug has been the solution for so long, right? The drug is the thing that treats the pain. The drug is the thing that treats the fear, the anxiety, the impact of stigma, the trauma. The drugs do a good job of treating those things. What's unfortunate is that they also come with this giant buffet of unintended consequences, right? If all that fentanyl did was treat the pain, it would be a beautiful thing. But that's not the reality that we live in. It comes with this buffet of unintended consequences. And those are the things that we try to heal. Those are the things that we work through. Those are the things that we find solution for as we engage in treatment.
Well,
go ahead.
I think a really important part of that is that people think that people use drugs to get high, and the vast majority of my patients don't. They use drugs to forget. Most of my patients use because of a significant history of trauma. People have histories of sexual assault or physical abuse and things that they're trying to forget, and they don't have access to what they really need, which is high quality mental health care or high quality primary care, things that would have. I have patients who I now treat with just regular anti-anxiety medications that any of us could get at our primary care doctor, but they could more easily access fentanyl than they could access a primary care doctor. And so people use for a reason. And if we can help interrupt that cycle of how they even start, get them access to what they really need, which isn't fentanyl, which isn't methamphetamines, that makes a huge difference. But I always say, folks, don't wake up in the morning saying, I'd really love to get addicted to heroin. That sounds like the best thing to me. It's that people wake up often in pain, physical or mental or both, And they have more access to illicit substances than they have to the medical treatment that would help them get better.
And I think ravages of addiction is an appropriate way to say it, isn't it?
Yeah, it can really destroy your life. And a lot of my, one thing I like to help folks understand is kind of how opiates work in your brain. In your brain, you have these things called opiate receptors, and that's how you respond to anything that feels good in your life. So in your normal life, if you have like a tasty meal or a nap or like or the Seahawks win the playoffs, you get your opiate receptors light up. But if you've taken opiates for a long period of time, you grow too many of them. And eventually, over time, that gets to the point where nothing except opiates lights those up. So having a hug from your mom doesn't feel the way it used to. Having a delicious meal doesn't feel the way it used to. And so when people have family members with opiate use disorder, that often helps explain behavior that doesn't make sense. Like, why doesn't he come around? Why doesn't he seem to care? He does care, but this medication has changed his brain. And so he can't respond the way he used to until we get him access to treatment.
Colt, in treatment too, we talk about fentanyl. I mean, just kind of the way the potency, I guess, of these drugs has changed. How has that changed how you have to approach treatment for folks now too? I would think that's also played into it.
Yeah, so emerging fentanyl use has radically changed the way that medications for opioid use disorder are prescribed and administered, right? Historically, things like methadone and Suboxone Care have been used to treat, at its worst, heroin use, right? And now with emerging fentanyl use, the way that we respond to it is very different. What has been really, really helpful recently is that federal guidelines have radically changed to help people access medicine in a way that benefits the patient more than history has seen yet. People are able to access medicine and arrive to the clinic less often, engage in counseling more frequently or more in depth. These federal guideline changes are helping our patients, and it's a response to two things. Really, it's a response to COVID. COVID helped our patients come to the clinic less often. And during the time that patients were coming to the clinic less often, big in-depth studies were done to show that when we give our patients take-home medications, the instances of diversion, where one person's medicine ends up in another person's hands, doesn't increase, and instances of methadone-related overdose doesn't increase. Magically, when we treat people like people, outcomes improve.
So, well, but I think that's with anything, whether I come with a flu bug or if I have an addiction, right?
Yeah.
Well, and these are serious medications. We have to treat them with respect and be thoughtful in how we prescribe them. But yeah, we used to be really hamstrung by very intense federal rules that were methadone was much more heavily regulated than, the oxycodone that I could prescribe in my primary care clinic. And so we weren't able to treat people's symptoms. But now we have a little more flexibility to really get people feeling better because, like we talked about, people use to make trauma go away in the beginning, and unfortunately it compounds trauma in their life. But the other biggest reason my patients use now is just to make the withdrawals go away. Yeah. The withdrawals are overwhelming, and the medication can help take that away.
Yeah, that boy, and I've seen folks who are dealing with that, and it's not good. I mean, I understand. It makes you realize, that's easier to take care of than trying to, push through it or get to see you if they, need a prescription for something that's not fentanyl.
Yeah, withdrawals for most of my patients are the worst feeling they've ever had in their life, and they'll do anything to make that go away. And so what I always tell folks is I can do that better with medication than you can with fentanyl, and then we can get to the real work of what got you here to help you stay sober in the long run.
That's a beautiful frame. I like that.
Okay, so why should folks take part in this? If there's people in radio land who say, well, this isn't, I'm not addicted to anything, I don't seem to have this. I think you nailed it, though. We all have somebody or somewhere in our family or close friends that are dealing with something like this. But Saturday, why should someone get off their couch and come at least take part in part of this?
Come on down to learn. Come on down to be a part of the community. We all live here. Unfortunately, our county has been hit really hard, so you have neighbors who are affected, even if you don't know. So come learn, come be a part of it, come show support. I think it helps to know that people with an opiate use disorder look like everybody else, and spend a little time getting to know your community and showing that support. We'd love to see anybody down there.
All right, Colt, last words.
Yeah, Todd, you mentioned one reason to decline going, and the reason you mentioned was, I'm not addicted. Why would I need to go? And I hear that same kind of declination when the topic of naloxone comes up. I don't need to carry naloxone or Narcan because I'm not addicted. I understand that point of view, but I think that it's a little too simple to be clear. It's not about the naloxone that I would carry in my pocket isn't about saving my life. It's about 7 billion other people that could be saved. The Narcan in my pocket isn't going to reverse me. It's going to reverse anyone else who could be overdosing. It's the same reason to come on down to International Overdose Awareness Day. It's not about what I could be facing, but it's about how I can help my brother and sister friend around me.
And we will have naloxone. We'll train people on how to use it so that you can save someone in your own community.
All right. It all gets started about 11 o'clock. City Pier is where the resource fair goes, and then march up to the city to the county courthouse, where there's going to be a few speeches and a few things, a memorial thing, and it's just a well, as it says, it's overdose awareness. It's a very awareness type of a day, and I appreciate you folks for putting it all together and coming on today.
Thank you for
Berry,
having
it's
us.
great to have you back.
Our
Allison
pleasure.
Berry and Colt Smith, good to have you on too. Thanks
Todd,
for coming
good
back.
to see you.
It's
Thanks for
good to
hanging
see
out with us.
You got it. We're going to take a break, and we'll wrap our show up right after this.
This is the Todd Ortloff Show on News Radio KONP.